For my in-service training, I'm going to discuss the CARE 2 risk assessment. My placement, which is a therapeutic foster care agency, uses the CARE 2 to identify potential risk factors for our clients, and it also helps us to identify interventions and other strategies to utilize when necessary. In my opinion, I think that this CARE 2 risk assessment best relates to the ecological systems model, in that I think it really takes a holistic look at an individual being assessed. All of the items, and there's 57 of them, I think, really go through all the different levels of or systems within an individual's environment, including their education, their schooling, their peer relationships, their family, their own personality, how they are within society. So it really adopts a holistic view, and the questions are really targeted at that comprehensive perspective. I also think that a unique thing about the CARE 2, which is kind of like the ecological systems model, is that it really focuses not just on the deficits within an individual's environment, but also the strengths, and plays off of those. So I think that that's unique about this tool. The CARE 2 was developed by psychotherapist Catherine Seifert, and she specializes in family violence and trauma, which most of the clients at my placement have endured numerous traumatic and violent events within their family system. So I think that this risk assessment tool is very useful for the population I work with. I also think that because it's based on the holistic ecosystems model view, that it's very adaptable to the many different use that we see in foster care. So it kind of works with the different needs and risks and clients that we assess. So I guess we'll start to go through it. So this is the packet, and this is the CARE 2 risk tool. And it includes 4 gender and age norms. So the individual that you're assessing will fall into one of the 4. They have to be between the ages of 6 and 19. So you'd have the preteen male, which is ages 6 to 12, the preteen female, 6 to 12, the teen male, which is 13 to 19, and the teen female, which is 13 to 19. And so you would just choose the column that applies to the individual that you're assessing. We're going to use Amelia, and she's a 13-year-old female, so she would fall into the preteen female category. So, and all the items that are covered in this packet, all the items or the questions that are asked, are either historical behaviors, which means they could have happened anytime in the youth's life, or they are recent behaviors, which means they have to have occurred in the last 6 months in order to apply for this assessment. So there are 2 sections. The first section is the risk score. So you would do this section first. And then the second section is the resiliency score. And so that kind of looks at the strengths of the individual and their family and other supports that they have. So then you would get 2 scores. You would get a risk score and you would get a resiliency score. And those 2 would be added at the end to get the final score. So the client we're assessing today is Amelia, and she's a 13-year-old female. And she entered care due to severe neglect as well as physical and sexual abuse by her biological father. She has a history of sexualized behaviors involving her younger sister, and she's currently diagnosed with PTSD. So we're going to just start to go through the packet. We probably won't go through all 57 items for the sake of time, but we'll just start going through. Item number 1, choose one. Severity of behavior problem history. So that includes aggression, delinquency, acting out, behavior requiring school suspension. So you would either have 1A, which is no history of behavior problems, 1B, which is primarily mild behavior problems, C, which is moderate, and D, which is chronic. And I've indicated that Amelia would fall in the moderate behavior problems. And you can see here that whichever score you choose, there are interventions here that are suggested. So for primarily moderate behavior problems, they suggest cognitive behavioral techniques, behavior modification, positive reinforcement, those types of interventions. The second one, verbal aggression. 2A is one minor isolated assault, minor fights or with peers or siblings. 2 to 3 assaults is the next level. 2C is assault causes injury or death, and chronic assaults more than 3. And I would say Amelia falls into one minor isolated assault. And so I circled the score indicated here. And as you can see here, it's this asterisk. So within this tool, the CARE 2 assessment, you're either given, the score you get is either a number, so it's a numeric score, or it's an asterisk. If it's an asterisk, there's no numeric value added, but it is just something to be aware of, and they do have recommended interventions just to look at. So it's good to at least identify these, even if they don't contribute to the score numerically. So number 3 is sexual assault of another. She does have a history of sexualized behavior, so she would that would apply to her. That again, that's an asterisk score. So no score is no numeric score is given, but it does give recommended intervention strategies. So we'll skip ahead a few. Has been bullied by peers or abused by others. She has been, so you would circle that. Neurological impairment, that doesn't apply to Amelia. Psychiatric symptoms, depression, anxiety, fears, phobias, ADD, that does apply. Family history of violence, abuse, neglect, or criminality, that would apply to her. Abuse or neglect, age 4 or above. She does have a history of being abused all the way through her childhood, so that would apply. Family has low warmth, high conflict, that would apply to Amelia's family. Caregiver history of insufficiently treated psychiatric disorders or substance abuse, that would apply also. We'll skip ahead here. Bullying behavior. She does show bullying behavior. She has a history of bullying behavior in school, so you would indicate yes for that. Poor social skills or very slick and glib, superficial relationships, con artist, etc. That would apply to Amelia. Deviant peer group, primarily antisocial or delinquent friends. That would also apply. And then, so you just go through this, indicating the ones that apply. We're at section 2, and these are kind of the strengths or resiliency scores. So let's go through some of them. Supportive, nurturing caregiver or other adult with appropriate boundaries. She is in a stable and nurturing foster home, so that would apply. Appropriate parental discipline at present time, and that would apply. Positive school experience. Currently, that would apply. Lack of psychiatric or substance abuse problems in youth or family. Currently, that would apply. Appropriate and achievable future goals. That would also apply. And for any of these that don't, any of these strengths or resiliencies that don't apply, there are recommended interventions on this side, including family therapy, IEPs, Big Brother, Big Sister mentoring, career planning or vocational training. So they do identify recommended interventions. So I went ahead and added up all of the scores for Amelia, and she scored a 44. So when you get the score, you go to the page in here that kind of breaks the scores up and gives recommended interventions. She is a preteen female, so we're always looking in that column. And she scored mildly on the CARE 2. And so that indicates that outpatient services would probably be sufficient. And that is similar to what therapeutic foster care is. It's more of an outpatient service. She's in a home. She's not in a residential facility. She's within the community. So that's similar. And it also recommends interventions for all problems identified by the CARE 2, and a lot of the recommended interventions were individual therapy, family therapy, and behavior modification, which are things that are all being provided through TFC, or the Therapeutic Foster Care Agency that she's with, and also through the foster home and the foster parents. Where resiliency factors are missing, build strengths in youth and family systems. So she does partake in family therapy with her foster home family. So she is building on those. She's getting tutoring, and she is using a mentor. So we are building on some of the strengths that have been identified by this tool. Weekly services are likely to be effective. And that's similar to what she's, the services that she's receiving at this point through our placement. She's getting weekly individual therapy, and she's also getting case management, which checks in with the family and works with the family to promote a nurturing and safe environment. So as you can see, that this tool is really good at kind of assessing some potential risks, which is, I think, is important especially at the placement I'm at, where we get clients on an emergency basis or without having much background on them. So to be able to use this to help us identify areas that may become problematic in the future based on the individual's history is really beneficial and can kind of decrease the probability that some of these problems that are discussed in here occur. It also really elaborates on the way these individuals may have reacted to certain crises. So it does indicate kind of techniques or strategies or therapies that may be applicable to the issues they're facing at this time. So that's it.